Good afternoon, everyone, and thank you for joining us. My name is Gabriel Perez. I'm a Senior Benefits Analyst with Lacers. I'm going to be your host for today's IRMAA event. I want to take a moment to thank all of you for your participation in today's event. Through your attendance today, your responses to our survey, through the questions you've submitted, we really appreciate your participation. So let's take a brief look at an agenda for today's event. We're going to begin with a look back at how we got here, which is what brings us to today's event. A little bit later, our health team will talk about Medicare and what is Medicare, and we'll follow that by talking about Medicare Part B only. And finally, we'll have a presentation on what is an IRMAA. We'll run that out with some important information that we think you'll need to know then about Medicare and IRMAAs. Now, next up, I would like to welcome our Lacers Board Commissioner, Mike Wilkinson, to hop on and say a few words to us.
Okay, I have to master the technology first. Thank you, Gabriel. I want to make sure that I was both looking at you and speaking as well. So I had a microphone problem earlier on. Anyway, thank you so much. Hi, everyone. I really appreciate being here and a chance to go and address you. I understand that we have over 150 people signed up for this, so I think that's just wonderful. Thank you for attending this webinar on IRMAA and Medicare Part B reimbursement. This program is designed to give you information about the current process and the path forward. We're pleased you're participating in this program. While IRMAAs were designed to cover higher income taxpayers, certain factors push people into being covered by IRMAAs who did not expect this. Inflation and other factors such as the required minimum distributions may trigger IRMAA payments, and this is a big and unwelcome surprise for many people. This meeting is designed to give you information, but also to get information from you about how IRMAAs affect you. The board has commissioned an actuarial study on the cost, which is needed before its submission to the City Council to act on this matter. As chair of the Benefits Administration Committee and the only retired elected member of the Lacers Board, I fully support this process. On another issue, I'm happy to report that the board has approved the renewal of the existing health, dental, and vision plans for 2024. So if you're happy with your current plan, that's good news. We haven't taken anything away. But there's one important change. We've added back a Medicare supplement plan through Anthem Blue Cross. This is an item that was requested by several members, and will be in addition to the existing Anthem Medicare Preferred PPO, which is a Medicare Advantage plan, although it doesn't have it as part of its name. So that new plan will still be there, but we'll be going back to having the option of having a Medicare supplement plan for the people who want that. So anyway, thank you again for joining us, and turn it back to Dale Wong Win. Thank you.
Hello, good afternoon. Thank you, Commissioner Wilkinson, for your comments, and thank you for your leadership as the chair of the Benefits Administration Committee. My name is Dale Wong Win. I'm the Assistant General Manager over the Benefits Operations Bureau. That includes the 3 divisions that provide daily service to our members. We've heard quite a lot from members and from our retired Los Angeles City Employees Association, also known as RLACI, over the last few months about the impact of Medicare and IRMAAs. A sampling of these comments can be seen on this slide. And what concerns many members, so many members, also concerns Lacers. So this session aims to educate members about Lacers benefits, Medicare, and IRMAAs. We will also provide information about the process to change Lacers benefits. And lastly, we'll discuss the next steps in the process. Before our health advocate presents our benefits, I wanted to share a few important points. We will provide a lot of information to you about the Lacers benefit and Medicare. Don't worry if you don't catch everything in this part of the presentation, because we have 2 very good Medicare videos on our Lacers YouTube channel that you can watch at any time of the day. Also, we'll have additional reference materials that you can find from our Medicare IRMAA webpage. And you can also contact a Lacers representative by phone or email with your specific questions. Next slide. I wanted to emphasize that Lacers has a specific role in this process. We hear you and we understand your concerns. Lacers staff are also members, so this issue will impact us as well. But we are here to fulfill our role as administrator. We're a neutral party, a subject matter expert, and as administrator, we cannot take a position for or against any benefit change. In this slide, you'll see the different roles of the key parties that are involved in a benefit change discussion. So first is the City Council. They're the decision maker on LACER's benefits. As you know, City Council has a wide range of priorities, various constituencies to answer to, and they decide which projects or programs to fund. As it relates to LACER's benefits, the final step needed to enact a benefit change is for the City Council to adopt an ordinance codifying the benefits that you want to have changed. Next are stakeholders, and stakeholders are anyone who has an interest in LACERs. That is members, our LACI, the City Administrative Office, unions, perhaps other city pension systems, or the neighborhood budget advocates. Keep in mind that all stakeholders will not necessarily share the same view. Members and stakeholders hold the responsibility to advocate, lobby, convince, work with, and negotiate with the decision makers. Lastly, LACER's role is to administer the benefits as written in the Los Angeles Administrative Code. Quite often, there's a misunderstanding that our LACER's board can adopt benefit changes, but in fact, nearly all of the benefits, including who is eligible, what the requirements are, how it's calculated, those are all contained in great detail in the Los Angeles Administrative Code. LACER's job is to make sure the plan is in compliance with the charter, the administrative code, Medicare requirements, tax requirements, and all other statutory and legal requirements applicable to LACERs. However, LACERs can provide information about your benefits so you can make informed decisions. We can also provide information to the city about LACER's benefit when they are considering benefit changes. And we can share communications of our members' concerns on topics to the city stakeholders. And we are committed to collecting members' experiences, stories, and comments. We can also increase education for our members, listen to our members, prepare a report to the board, which will include comprehensive information that hopefully facilitates action by the decision makers. So at this point, I'd like to introduce Terry Macias. Terry is a benefit specialist in our health division advocacy unit. She is an expert on LACER's health benefits and provides daily counseling to members. She is here to present a primer on the LACER's benefits, Medicare, and IRMAA. Take it away, Terry.
Thank you, Dale. Good afternoon, everyone, and welcome to Understanding Medicare Basics and Income-Related Adjustment Amounts presentation. My name is Terry Macias, and I'm a benefit specialist in the health division. Sorry, give me 1 second. I'm trying to get my. There we go. So let me bring your attention to the following disclaimers. This presentation is intended to provide a summary of the benefits established by the Los Angeles City Charter, Los Angeles Administrative Code, and LACER's board rules, referred to as the plan provisions. In the event of discrepancies in this presentation, the plan provisions will govern at all times. Information provided in the presentation regarding the rules under the Centers for Medicare and Medicaid Services, as well as Social Security Office, may be subject to change and are not within LACER's control.
Hey, Terry, sorry to interrupt. I don't believe you're sharing.
Yes. Oh, okay. Give me 1 second. Am I sharing now?
It's waiting. Oh, there you go.
Ah, okay. I apologize for that. Before we begin with the presentation, I want to bring this slide to your attention to any of the active members joining us today. If you are still working for the City of Los Angeles, you are considered an active member. As an active member, you currently have medical coverage through employee benefits, and you do not have to apply for Medicare while working for the City of Los Angeles. You and your dependents only have to apply for Medicare if you are retired and approaching age 65, or if you retire after turning 65. The topics we will be going over today apply to retired members who are Medicare age. Please be sure to contact Blazers if you or your dependents are Medicare age at the time of your retirement. What is Medicare? Medicare is the federal health insurance for anyone over the age of 65. Some people may be eligible for Medicare earlier with certain conditions. This program was established in 1966 and is managed by the Centers for Medicare and Medicaid Services, or also known as CMS. Medicare assists with the cost of healthcare, but it does not cover all medical expenses or the cost of most long-term care. The three main parts of Medicare are Part A, B, and D. Part A is the hospital insurance, which helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Part B is medical insurance, which helps cover services from doctors and other healthcare providers, outpatient care, durable medical equipment, and preventative services. Part D is drug coverage, which helps cover the cost of prescription drugs. Blazers has requirements to all members or dependents who are eligible for Medicare. According to the Los Angeles Administrative Code, all retired members and any dependents must enroll in Medicare when they are eligible. The member and dependents are required to enroll in Medicare Part B and enroll in Part A only if premium free. You will not be allowed to enroll in a Blazers plan without your Medicare in place. You must pay the Medicare Part B premiums to maintain coverage, and we will go over what can happen if your Medicare lapses later in the presentation. If you retire at age 65 or older, Medicare allows you and your dependents to defer enrollment in Medicare Part B until you retire. This is known as a special enrollment period. You may be wondering, when do I have to enroll in Medicare? You can first enroll in Medicare 3 months before your 65th birthday, and you have until 3 months after your 65th to enroll. If you miss this time period, you may have to wait until the next open enrollment period. Not enrolling when you are eligible may subject you to possible late enrollment penalties and losing Blazers coverage. If you are an active employee and over 65 at the time of retirement, you will enroll in Medicare when you retire. Health staff will provide these members with a special enrollment period form at the time of retirement that will allow you to enroll in Medicare without the late penalty. Blazers does not enroll members into Medicare. You must contact the Social Security Administration. City of Los Angeles employees hired before April 1st, 1986 were not paying into Medicare and do not qualify for Medicare Part A premium free solely through city employment. They can still get Part A premium free through their spouse who qualifies for Part A or through outside employment. Employees hired on or after April 1st, 1986 are paying into Medicare and will be eligible for Part A premium free after 10 years of employment. The current FICA rate for Medicare is 1.45% for both the employee and employer. Los Angeles Administrative Code and LACER's board rules require that you and your dependents who are Medicare eligible must enroll in Part B and Part A only if premium free. If you do not qualify for Part A, premium free, you only need to enroll in Medicare Part B. LACER's members with Medicare Part B only. Medical subsidy is the same as the subsidy for the non-Medicare members, are not eligible for the basic Part B premium reimbursement, must maintain their Medicare eligibility. Medical plans available are not the same Medicare benefits as those available for A and B members except for the Kaiser Senior Advantage Plan. Although Medicare Part B only members are now eligible for Medicare Part A, members who are enrolled in LACER's retiree health plans have hospitalization as part of their benefits. Medical plans available for members with Medicare Part B only: Anthem HMO, Anthem PPO, Kaiser Senior Advantage HMO. The Anthem HMO and Anthem PPO plan benefits for Part B only members are similar to the non-Medicare Anthem plans. The Kaiser Senior Advantage HMO plan is the same for Part B only and A and B members. Why can Medicare Part B only members enroll in Kaiser Senior Advantage plan, but not in other Medicare plans such as United Healthcare, SCAN, and Anthem Advantage Preferred PPO? Kaiser Senior Advantage plan was approved by CMS to allow LACER's Medicare Part B only members to enroll in this Medicare plan with Medicare Part A benefits. Currently, LACER's other Medicare plans such as United Healthcare, SCAN, Anthem Advantage Preferred PPO are not approved by CMS to allow LACER's Medicare Part B only members to enroll in these plans. What is an income-related monthly adjustment amount, or also known as IRMAA? Social Security is required by federal regulation to assess IRMAAs on those who have higher incomes as a cost-sharing measure to strengthen the financial stability of Medicare. IRMAA is a surcharge on top of the basic Medicare Part B and D premium rates. And IRMAA is assessed when the Medicare enrollee's modified adjusted gross income, or MAGI, amount from 2 years prior exceeds a certain threshold. MAGI includes, but is not limited to, employment earnings, investment income, capital gains on the sale of real estate, and or gambling winning in addition to the retirement allowance. How is an IRMAA determined? IRMAA is determined by your modified adjusted gross income and your tax filing status. Social Security uses the most recent federal tax return, which is generally from the tax return filed 2 years ago. For example, for the 2023 IRMAA determination, the most recent federal tax return is the one filed in 2022 for tax year 2021. The IRMAA is based on your modified adjusted gross income, is used, and the income levels for IRMAA are adjusted each year. The income levels are based on your tax filing status. For example, someone who files as single will have a different IRMAA income level than someone who files married filing jointly. If your modified adjusted gross income is more than the determined amounts, you will be assessed an IRMAA. For example, for 2023, if you file an individual tax return, you will be assessed an IRMAA if your income is more than $97,000, while the income level is $194,000 for a married and filing jointly member. Social Security will inform you if you have been assessed an IRMAA. How long does an IRMAA last? IRMAAs are calculated every year using your income provided by you to the IRS. You may have to pay an IRMAA one year, but not the next if your income falls below the threshold. However, if your income increases, then you may be subject to the IRMAA. Social Security will notify you of any changes. This is a common question. Do I have to pay the IRMAA? The answer is yes. If you are assessed an IRMAA, you must pay the Medicare premiums and the IRMAA. As Lasers does not make any payments or collect any payment, you must pay the Medicare premiums and IRMAA to Social Security directly. Lasers also does not assess the IRMAA. If you do not pay the premiums and IRMAA, your Medicare coverage will be terminated. We will go over what happens if you lose Medicare coverage in the next slides. What happens if you do not pay your Part B premiums or IRMAA? Medicare will terminate your Part B coverage. Lasers will terminate your Lasers medical plan enrollment for you and your dependents. You will not be eligible for the medical subsidy, and you will be responsible for the full premium payment. Your Medicare Part B basic reimbursement will be terminated, and you will be responsible for the repayment of the reimbursement. What happens if you do not pay your Medicare Part D IRMAAs? It is similar to losing your Medicare Part B. Medicare will terminate your Part D coverage. Then Lasers will terminate your Lasers medical plan enrollment for you and your dependents. You will not be eligible for the medical subsidy, and you will be responsible for the full premium payment. Your Medicare Part B basic reimbursement will be terminated, and you will be responsible for the repayment of the reimbursement. Please note that Lasers does not process your Medicare payments. Lasers does not make any payments to Medicare. Lasers cannot directly pay your Medicare premium from your Lasers monthly allowance. You are responsible for making the payments to Medicare. The following slides are for your information. This is a graph of the 2023 Part B IRMAA income bracket. If you would like to look at it more closely, you can find it on the CMS website, which we will provide in a later slide. This is a graph of the 2023 Part D IRMAA income bracket. Lasers does not have jurisdiction towards the requirements related to IRMAA. The Los Angeles Administrative Code only provides Lasers the authority to reimburse the Medicare Part B basic standard premium for retired members who meet all the requirements. This reimbursement does not apply toward dependents who are not a retired member or eligible survivors. Lasers does not reimburse any IRMAA or penalty costs. This information is based on information provided by Social Security Office. For an appeal, please contact Social Security for more information. Lasers cannot speak to Medicare or Social Security on your behalf. If at any time you have any questions about your Lasers health benefits, please contact Lasers at 800-779-8328 or email the Health Division at lasers.health@lasers.org and visit our website, lasers.org. Thank you.
Thank you, Terry. Our next topic is how to enact a change to the LACERS benefit. This slide outlines the typical process to get a LACERS benefit change for active members. Changes to the retiree benefit have not been done in recent history, but the main difference in the process would be that there is no employee union to advocate on behalf of their members, leaving this role to the stakeholders to fulfill. So in the first step, LACERS is brought in by city management as the subject matter expert, and city management typically being the CAO. We provide information to the CAO and unions when requested on how the benefit currently works. When proposals on benefit changes or enhancements are discussed, LACERS weighs in on things such as how many people might be affected, whether we know of any statutory impediments to the proposal, whether the proposal can be administered by our staff, and how the change may impact members in various scenarios. Typically, the proposed benefit begins to take shape with everyone's input, and sometimes the CAO and unions want to add benefit options or alternatives for the actuary to study. In step 2, every benefit change presented to the City Council must be accompanied by an actuarial cost study. This is a requirement in the administrative code. LACERS actuary is brought in to consider the proposed benefit and determine the actual demographic information that is needed to create the study. In step 3, the City Council will review the cost study and decide whether to take action or approve the benefit. If the City Council wants to approve the benefit, the City Attorney will be requested to draft the ordinance, and the ordinance will return to Council twice before adoption, and that is also contained in the administrative code. Lastly, in the 4th step, once the benefit is adopted by City Council and well detailed in the ordinance, then LACERS is able to take over administration of the benefit, starting with adjustments to our system of record, changes to our documents, and an education campaign to inform members of the changed benefits. Next slide, please. There we go. When LACERS reviews a proposed benefit change, we weigh in on the administrative feasibility of the proposal. So we're guided by our responsibility assigned in the charter, and that is to provide timeliness of the benefit delivery. We also work with the actuary to make sure that a reliable cost study can be generated. And there are situations where the needed information is not available to the city, LACERS, or the actuary. In that case, if a cost study of the benefit cannot yield a reliable result that meets actuarial standards, the parameters of the proposed benefit must be changed. Next slide, please. Next slide. Oh, no, stay there. That's it. Okay. In the next 2 slides, this shows the proposal that our LACI and various members have requested in terms of certain changes to the benefits. And so they're summarized here. Basically, regarding reimbursements of the Medicare Part B premium, currently, Part B only members do not receive the basic Part B premium reimbursement of the basic Part B premium, and this is pursuant to the administrative code. A proposal seeks the same reimbursement as members with Medicare Parts A and B. And Medicare members with Medicare Parts A and B are seeking reimbursements of their IRMAA. A city ordinance is needed for these 2 benefit changes. From an administrative standpoint, LACERS does have concern because the actuary is not able to generate a cost study for the reimbursement of the benefit based on members' federal MAJI. Again, that's your modified adjusted gross income that comes from your federal tax return. Without that MAJI data, or actual Part B premium data for all retirees who currently pay a Part B premium, the proposed benefit cannot be costed. Therefore, to create a cost study with a high degree of reliability that meets the actuarial standard, the actuary studied the cost of providing IRMAA reimbursements based on the member's LACER's retirement benefit only. With only the retirement benefit information available for each member, the actuarial study costed the reimbursement based on IRMAA thresholds assigned to the member on a single versus married basis in accordance with the IRMAA thresholds that were shown in the earlier slide. Another common request from members is to allow member reimbursement for IRMAAs from the excess subsidy, the way that DWP administers their benefit, and that's found in the next slide. Okay. Retiree health benefits are administered based on each plan's governing documents. So DWP and LACERS have different governing documents. The Los Angeles Administrative Code authorizes LACERS to provide two separate reimbursements. One reimbursement is for the member's Medicare Part B basic premium, and a separate pot is provided for the reimbursement of health premium subsidies. On the other hand, for DWP's pension system, they're authorized to provide one reimbursement from one pot, which can be drawn on for health plans and for the basic Part B basic premium reimbursement, as well as IRMAAs up to the reimbursement bucket. Now, maintaining two separate reimbursements is actually a greater benefit because it ensures that members receive at least the basic Part B premium reimbursement, even if they don't have excess subsidies. This would apply, for instance, for members with few years of service or members who have high premium costs or dependents to cover. They would not have any excess subsidies, which they can access to pay for even their basic Part B premium. On slide 38, from a request from several Part B only members, and this would be to allow their participation in the same Medicare Advantage plans offered to Part A and B members. This is really under the jurisdiction of the Center for Medicare Services and plan carriers. The city has no authority in this matter. So in order to get this benefit, the Centers for Medicare Services as well as plan carriers would have to take action. If this were to change, LACERS doesn't have any concerns in terms of administration. It could be something that we can administer. So at this time, we'll answer questions submitted by members, and I'll hand it over to Gabriel Perez.
All right, thank you, Dale. So as I mentioned, we had participants were invited to submit questions in advance of today's presentation. And so we have a few of those questions that I will be reading out right now. And Terry, who presented for us earlier, will be answering those questions. You ready, Terry? First question.
Gabriel.
The first question is that the IRMAA study does not address the IRMAA required for Part D in addition to that of Part B. LACERS members are required to pay this penalty as well. So why did the study not include an analysis of Part D IRMAA?
The Part D IRMAA was not included in the current cost study, which only included Part B. If you would like Part D IRMAA added to the next cost study, you would have to advocate to the City Council to include Part D IRMAA and other additional benefits in the next cost study.
Thank you. The next question that we have, is the IRMAA really irrevocable or reversible?
This is a question for Social Security Administration. As the SSA reevaluates IRMAA every year based on income data provided by the member to the IRS, and will notify them of any changes.
Okay, thank you. Next question. So when I turned 65, my LACERS retiree with Medicare A and B health plan premium is lower than my subsidy before I turned 65. Where did the rest of my subsidy go? And is LACERS saving or keeping this amount?
So this is a pretty extensive answer, so bear with me. The Los Angeles Administrative Code provides how the medical subsidy is to be calculated and applied based on the retired member's Medicare status, meaning if they have Part A and B or B only. The subsidy of retired members with Medicare Parts A and B is based on the single party monthly premium of their senior plan, while the subsidy of the retired members under 65 or with Medicare Part B only is determined by LACERS board and or the Los Angeles Administrative Code. When a member is Medicare eligible, LACERS Medicare health benefits are partially funded by Medicare. Therefore, the subsidies are different than under 65 members. Thus, LACERS is not saving because the subsidy is different. Rather, the Los Angeles Administrative Code provides a different subsidy amount for members over age 65.
Thank you, Terry. And so the final question I have for right now, can I appeal my IRMAA?
And the answer is yes. According to Social Security Administration, you can request an appeal, also known as a reconsideration, in writing by completing a request for reconsideration, which is form SSA-561-U2. This form is available online at www.ssa.gov/forms, FORMS, or by calling Social Security at 1-800-772-1213 to request an appeal form or an appointment with your Social Security office.
All right, thank you, Terry. That's going to conclude the questions that we have prepared for this. So you do appreciate your time in answering those questions. Now, for anyone who does still have any outstanding questions, of course, the Q&A is still open. In the meantime, what I'm going to do, I do want to thank you all for joining us. We've prepared a quick review quiz to help reinforce some of the information we have presented today. I'm going to be launching that in just a second. You should see the, oh no. All right, I guess we're going to forego that since I'm having some technical problems here. But what I will do here in the meantime is like to remind you that you can find further information on our website, lacers.org, including ways that you can submit questions, comments, participate in our surveys if you haven't yet. I'm going to share that just a second. And you'll also be able to find info about our upcoming in-person and board meetings, as well as links to some relevant videos on the LACERS YouTube channel about Medicare and IRMAAs. So on our main page, we do have it right now. We've noticed you noticing the impact of IRMAAs. And if you visit that page, you will find all of the information that I just described, information about IRMAAs, information about the meetings, agendas, invitations to participate in our surveys and public comment and video resources for you that are relevant. I do want to mention also that copies of the slides from today's presentation will be posted to our website soon. And with that, I'm going to turn this over to, I believe, our general manager, Neil Guglielmo, who will be rounding out the session for us. So Neil.
Thanks, Gabriel. So first off, I'd like to say thank you to all those who are typing questions in the chat and who have joined us today for the virtual webinar here on IRMAAs and Medicare. And of course, we do have another session coming up next week that'll be in person at the LACERS headquarters. We know this issue of IRMAAs, Medicare coverage, the costs, especially in retirement, is something that is an important matter for all of our members. And we've heard from many members over the years. It's taken some time, but we've gone through a process working with our board of commissioners. They've shown great leadership in this area, working with our actuary as well. And we're at the point now where we want to make sure that we incorporate fully the voice of our members, so we can go back to our board, and then assuming that we have a board approval, sending something across the street to the city council and the mayor for their consideration. As I think has been already stated a few times now, LACERS administers the benefit. We are city employees, just as you are city employees if you're still active, or were if you're retired now. We care about all of our members. We want to make sure that we do right by all of our members, that we administer the plan as well as we can, and that if there are gaps or issues, that we can raise those to the attention of our board, and we can bring it to the attention of the city as well. But ultimately, it is going to be up to the city whether or not they will approve any change in the benefits that we administer. So again, it is important for us to be able to convey information that we get from all of you to our policymakers, our board of trustees at LACERS, as well as to the city council and the mayor. But ultimately, your voice should also be heard across the street at City Hall. I think, reaching out on these issues, making sure that that your voice is heard, that your circumstances are understood, is important when this item hopefully comes up for debate and discussion in City Hall. So I just wanted to make sure to point that out. Next, there was a question about the video. Yes, this is being recorded and it will be posted on the website and the LACERS YouTube channel. And I will plug our LACERS YouTube channel. Anyone who has not had the opportunity to look up LACERS in YouTube, please do so. There are a great number of some very, very short, but very informative videos on there that it can help you unlock and understand better the benefits that you have with LACERS as a retired member, beneficiary, and such. That includes our LACERS Wellness Program as well, which is also on Facebook. So please, look us up online, go to the website, but also go to YouTube. If you have Facebook and are interested in our wellness programs, I encourage you to look it up. Great ways for all of our members to stay informed, to stay healthy, and as well as work with and communicate with other retired members as well. On the website, we have a specific IRMAA page. Many of you have probably already seen that. There's a survey on there. It's been mentioned here. I encourage everyone to take the survey because we are very much welcoming that information, and we'll be including it as a report back to our board. So again, please complete the survey and turn that information in for us. And then you can also make public comment. You can make public comment at board and committee meetings for LACERS. You could also use the link that LACERS provides on the website if you'd like to make a public comment on the IRMAA report, which has a council file number and is part of the city clerk's council file index. You can submit a electronic public comment. You don't have to go in person if you don't want to, but you can still do so. And there's many members that have already submitted comments. So I'd encourage you to consider doing that if you have not already. So I will stop there. I, again, just want to thank my staff for pulling this all together. All the questions that have been asked that we're not responding to directly during this meeting, we will have those questions up on the webpage, and we will have responses as well. Just give us some time. So some of the questions are a little more detailed. We want to make sure that we can address them fully. So we'll do that. We'll have those up on the website as well. And again, if you can join us in person, you would like to do so next week. We'll be hosting a IRMAA meeting in person, but I would encourage you to register in advance because room will be limited. If we have a turnout like this, then we would hate to turn members away if they make the drive into downtown. So please register if you're interested in going and attending in person the IRMAA meeting next week. Otherwise, thank you. Appreciate all of your time. Commissioner Wilkinson, want to thank you for your leadership. I know this has been an important issue for you and all of our commissioners. So again, most appreciated. And for all of you who have joined us, thank you so much. Have a great rest of the day. Just know that Lasers is in your corner. We're here to serve you and to serve the plan and really make your retirement the best that we can. So thank you and have a great rest of the day.